Days before Hurricane Helene made landfall, Americares was ready. We're always prepared. Americares maintains a roster of 850 trained emergency health experts ready to deploy. And our network of partners gives us a foothold. These are organizations that know Americares and the range of resources we can provide. I'm Kennedy Cease, Americares Senior Associate for Humanitarian Response, and I was on Americares' team of 30 responding to Hurricanes Helene and Milton. Our team was watching the storm, and before Hurricane Helene came ashore, we reached out to nearly 200 organizations in 3 states to offer assistance. Hurricane Helene pounded Florida, Georgia, South and North Carolina, Tennessee, and Virginia as a powerful Category 4 hurricane, nearly 400 miles wide. Many partners in Hurricane Helene's path had Americares Climate Resilience for Frontline Clinics Toolkit, which is available on our website at no cost.
Well, being in South Carolina, we were invited to be one of the pilot clinics that was involved in the Climate Resilience for Frontline Clinics Toolkit project. Boy, did we see that had paid off when we were able to quickly and immediately put into place a plan that helped salvage $250,000 worth of insulin and vaccines.
The storm was relentless. Over 6 days, Helene dumped more than 30 inches of rain in North Carolina, fueling deadly and destructive floods throughout the Appalachian region. More than 230 people died. Hundreds were rescued, and thousands of people were cut off from their basic needs, leaving entire towns underwater. We immediately deployed teams to meet with partners across 5 states and assess real-time needs. We rode along with local partners to check on rural communities and forged new connections. With needs lists in hand, Americares filled urgent requests for medicine and supplies, ultimately providing 17 tons of medicine and supplies to local organizations across the region.
So Americares was an absolute blessing from the get-go. And all of a sudden, this angel from Americares was in the building saying, "We're here to help. We can help in a number of ways."
Mental health is at risk after disasters. After Hurricane Helene, Americares deployed 8 mental health specialists to work in rotations in affected communities. In 13 health centers and our own mobile clinic, Americares provided immediate support, including psychological first aid, so that frontline health workers could return to their jobs, recover, and help their neighbors. Our mental health specialists reached more than 500 survivors.
Just days after Helene, Hurricane Milton made landfall in Florida, battering many of the same communities that were still responding to Helene. An additional Americares emergency team deployed to Florida. They quickly coordinated shipments and emergency grants to frontline organizations.
In North Carolina, when we learned that access to basic health services was a critical issue, we launched a mobile clinic. Over 17 days, Americares provided healthcare to survivors in 5 counties. Our mobile clinic was invited by local organizations known and trusted in each of the communities we served. Response experts from Americares' global roster staffed the clinic and included bilingual providers. At the clinic, survivors could access both medical and mental health services.
For weeks after Hurricane Helene, there was no running water in Asheville, which is a real threat to health. To restore access to water, we installed 4 water filtration units, each hosted by a community member.
The opportunity to be connected with Americares, to bring in the tools and the resources to actually deliver on the needs for the community. We'd be doing something, but it wouldn't be able to meet the needs that we can meet now with these units all over the city.
Americares also provided more than $1 million in emergency funding to 35 clinics and community organizations across the region. These funds were available quickly, so clinics could fill gaps, replace equipment, extend hours, restock medicine, pay staff, whatever they needed. Every dollar helped restore access to health services. That is our goal and Americares' mission. A year later, Americares is still active in Western North Carolina, helping communities recover. Our mental health programs are for caregivers such as healthcare workers, so they can process their own needs to be able to continue meeting the needs of others. With resilient health staff, frontline clinics will be ready for any challenge ahead, including floods and storms.
We felt seen. when Americares reached out, and since then we have some concrete plans in place to offer some trainings to staff, such as psychological first aid trainings and trainings for our behavioral health team. And I think those things only strengthen our teams and our staff and help them to know how to move forward from when this terrible thing happens.
1 year later, Americares is still here, listening to local health organizations and providing critical resources. This is the work you make possible. Thank you for your support. On behalf of Americares and the communities and partners we serve, thank you.